My name is Glenn Frost, and I'm a medical social worker at Roswell Park Cancer Institute. And a large part of my day is working with couples and assessing and working with them in terms of any intimacy concerns that they might have that have been brought on by either their cancer diagnosis or perhaps even their treatment or any post-surgical issues that are getting in the way of intimacy for them. One of the places where we start is really defining intimacy for couples. And I often will begin by asking couples when they have been intimate last. And they will, sort of sheepishly reply, maybe in the last week or so, something like that. And I comment to them that I'm assuming you're referring to physical intimacy, to which they reply back to me, well, yes, isn't that what you asked? And I say no. And then we start the discussion of other aspects of intimacy. For many types of cancers, the treatment itself can have many side effects that can really impact the level of intimacy that couples choose to have. And whether that's side effects from radiation or chemotherapy, maybe nausea, issues like that, or maybe real physical issues that are impacting, whether it's the result of a surgery, maybe it's a body-altering surgery that people have had. There are specific therapeutic interventions we can work with couples on in terms of specific physical intimacy. There are other techniques that we can work with couples on in terms of maybe not as specific physical intimacy, but some issues that are getting in the way of physical intimacy. What I find a lot working with couples is that the level of emotional intimacy can really be impacted by this diagnosis of cancer or by some of the treatments. And a lot of what I recommend is, it sounds maybe corny or cliched, but taking a trip down memory lane. And we talk about, getting out the old photo albums, getting out the old home movies, getting out the wedding album, getting out maybe the cards or letters that you used to send to each other, and getting back in touch with those other levels of intimacy that you had, that drew you together as a couple. And it's not just reminiscing about them, but recreating them. So remembering that we used to go on long walks and then going on a long walk. Remembering that sometimes we would just get in the car and drive for hours. Get in the car and drive for hours. Remembering those conversations you had, late into the night, and having those conversations, and that can be a real moment of intimacy. And in some ways, having a deep, meaningful conversation with your partner, in some ways can be even more intimate than a physical intimacy. This can potentially be an opportunity to really develop a level of intimacy that you may not have had before. So again, just contact your psychosocial oncology department, talk to your doctor, talk to the clinic, and certainly they can refer you directly to us.